Hello YouTube, this is part 3 of my series about my Xlif surgery. Today's video will cover days 8 through 14 post-op. So, to start with, on day 8, the pain in my back from the hardware was probably a 2 out of 10. Same with my hips, 2 out of 10. Lacing of my shoes, still problematic. I have to pre-tie my shoes and put it on because I'm still exercising. I'm walking twice a day, about 30 minutes a day. The pain in my hip starts to come on a little bit more as I hit that 30-minute mark, roughly about there. After I finish my walk, I lay down maybe for 30 minutes minimum, and I feel better after that. Sitting is still difficult, maybe 2-3 minutes maximum at this point. Day 9 post-op, the pain level in my back and hips are still about a 2. I went for my first car ride today. Sitting up was a little bit difficult, but what I found was when I reclined the seat almost to a laying position, I was okay. Went to Costco, walking around through Costco. It was okay and everything. I was using the cart kind of to hold myself up, so it wasn't too bad. But I went with somebody else to do my shopping because I know it would have still been a problem had I had to load my own stuff into the cart, such as a gallon of milk is 8 pounds, which is at my limit. But to reach over and put it in the cart may have posed a problem, but I didn't have to worry about that. So the car ride, the shopping, and the car ride back home lasted roughly about 2 hours, and I was pretty exhausted after that point. I needed to rest for a couple hours lying down, and I was good after that. I walked in the morning and afternoon again, 30 minutes each time. The hip and back pain just started to come on right around that 30-minute point. The side incision is still bothering me. It still feels a little bit raw, especially when the brace kind of rubs up against it. The back ones are pretty good at this point. Day 10, my back hardware pain and my hip pain is still a 2. My incision pain on my side is about a 3. Walking is getting a little bit easier. It's getting faster. Sitting is still a problem, still about 2 to 3 minutes, and it's bothering me after that point. What happens if I sit too long is I get that nerve pain come back also in my side of my leg, on my right leg, going down the side of my leg, and my foot. It kind of activates that pretty quickly. I'm still on my medications, trying to wean myself off slowly. Bowel movements are still normal and still eating healthy, keeping the weight off, so everything's good to this point. Day 11 post-op, my back pain is about a 2, my hip pain is back to a 1. My incision pain is still a 3, still bothering me. I'm still doing 30-minute walks twice a day. Usually about the last 5 minutes or so, my legs just start getting tired and that little bit of hip and back pain starts coming on at that point. Still early in the recovery period, so I don't expect to be running or anything anytime soon. I did some watering of my plants at my house. I used a half-gallon bottle, filled it with water, and did several trips back and forth from my kitchen to outside of my porch. The total trip was maybe 45 feet in length, and I probably did maybe 8 to 10 trips of that, and I was pretty exhausted after that. About an hour later, I noticed my foot start burning, so it's probably just from that extra work carrying that. Even though it's probably only about 4 pounds, that little bottle, it's still a lot of work to carry at this point. Next time I'll break it down to maybe 4 trips rather than 8. I sat down behind my computer for about 12 minutes today. I had shooting pain in my back when I got up. The pain level was probably about a 5 out of 10. That pain lasted maybe about 5 minutes, then it went away, but it gave me a good scare, and it reminded me, just take it easy. Maybe I'll try to work my way up to 5 minutes first before I try to go a little bit longer than that. The burning sensation in my foot is about a 4 when it did activate. Again, mentally it affected me more than physically. I took my gabapentin and the pain went down a little bit, but not a lot, maybe to about a 2. There was also slight pain in my lower leg from my knee down on the outside of my leg. Day 12 post-op, so that lower leg pain that I had from walking back and forth, I guess carrying the water and watering my plants, is gone in the morning. Both feet now have a slight burning sensation, maybe a 2 out of 10. It's more of a discomfort than a pain. The foot burning went away roughly about 30 to 45 minutes after I took my gabapentin. I'm reducing my oxycodone to twice a day rather than 4 times a day. I don't really have too much pain, so I don't think I need it anymore. And again, my walking is getting better. I mean, I can't notice it day by day, but I notice it is getting easier, going a little bit further every day. All right, day 13, good news. The hip pain is gone, no pain at all. The hardware pain in my back is still about a 1 or a 2. My walking speed is getting faster. My stride is about 3/4 of my normal stride previous to my back surgery and when I was pretty healthy at that time. I'm still walking an hour a day and I break it up in 2 sessions. So rather than 30 minutes now, I'm going a little bit further. So maybe 35, 25 or 40, 20-minute sessions at this point. There's still slight burning in my right foot. The left foot pain has gone, that burning sensation. The pain level is about a 2, or the ache pain is about a 2. And the incision pain is still there, a 2 or a 3, so it's gone down just slightly. So day 14 post-op. Today I meet at my doctor's office. This is the first of my 2 with the nurse practitioner. The first 2 I meet at 2 weeks, and then I'm gonna meet her again at 4 weeks, and I'll meet the doctor probably in about 8 weeks. So we did x-rays again. It seems like the cage is still in place. That's the main concern at this point. She asked me how my pain levels are. I told her that it's mostly my foot at this point. She said it's probably gonna activate a little bit more once I start my PT sessions. A little bit worried about that, but it's expected, so it won't take me by surprise. That's a good thing. I mentioned that my incision area is still bothering me. It's like a 2 out of 3 and it never went away. And she reminded me that there was heavy trauma done in that area. They did all the work through that incision. A lot of things were moved around. So that incision pain might last a while just because, you know, how much trauma was caused to that area. Not necessarily any harm done, but there was trauma. I scheduled my aqua therapy, which will start at 2 weeks, which is a 4-week mark, which I mentioned in my earlier videos. So at 4 weeks, I go to aqua therapy. In 8 weeks, I go to land therapy. So I will give you an update probably in about a month. And I'll give you an update when I start that aqua therapy also. This will give you an idea of what's going on with that. Pain levels in my hip, 0. My back pain is still about a 2. Incision pain, as I mentioned earlier, was 2 or 3. So pleased of my progress to this point. It's only 14 days post-op. And I hope if you have gone through this that you have done better than I have or at the same level and hopefully not worse. But I'll continue to make the videos just to keep everybody updated what's going on and to kind of let you know what to expect. Hopefully you'll have kind of the same kind of experience as me. All right, YouTube, I'll see you in part 4 soon.